In this video, we're going to go through my top 5 most commonly asked questions in regards to recovery and rehab post hip replacement. So if you're due to have one or have just had one, this video is for you. Now we're going to go through my top 5 questions that I commonly get asked and the bits of advice that I always go through with patients who are either about to have a hip replacement, about to have a hip resurfacing, or have recently had one. Now these 5 things are absolutely critical, and each one of them are important as the last one. So I'm sure you'll find it useful, and if you do, I want you to let me know if some of this resonates with you in particular. But we're going to start off with the first one, which is a commonly asked question, and that's recovery. How long is it going to take? What's it going to take to recover? And what my expectations are really, and as a patient talking. And really the recovery is dependent on so many factors. But if you're a young, fit, healthy, active individual who does a lot of exercise versus someone who maybe doesn't do as much and is a little bit more sedentary beforehand, well, the recovery timeframes are going to differ a little bit, you know? And also those who are a bit more active before tend to do a bit better, a bit quicker after surgery. So you need to consider that actually what you're doing before and your kind of lifestyle will definitely have some sort of impact. However, the recovery generally can be quite good. Now, if you're going to have a hip replacement, and this is whether it's an anterior approach or posterior, if you're having a total hip replacement, you need to give yourself a good 6-month window to really get back to where you would want to get to. And that could be someone getting back to doing walking or hiking or getting in the gym or just getting back to a level that you're content with. But let me tell you this, right? Even though it might take 6 months to get to that point, you are going to see some dramatic and significant improvements throughout that process, because that 6-month target, I should say, is really when you're getting to the latter stages of it. So you can do so well in those first few months anyway, but you have to make sure that you're aware of those expectations. Don't rush, and also give yourself that time to properly recover. But it takes a little bit of time. Now, if you're younger, maybe like I said, a bit more healthy, active, do a bit more exercise, then sometimes your recovery can actually be even quicker. And surgeries now, where it's anterior or even minimally invasive posterior approaches, enable earlier levels of recovery, quicker levels of mobility and mobilization, and allows people to really get the most out of rehab as soon as possible. Now, what's the biggest hindrance? This is point 2, right? So what is the biggest hindrance that limits and mitigates progression? Well, number one thing is pain, right? But you've got to remember the fact that you had a lot of pain before surgery. Your pain isn't going to immediately go the day after just because your arthritic joint isn't there. The whole process, the procedure, is fairly brutal, right? It's a big surgical procedure. They are essentially taking your hip out and replacing it. What do you expect? It is going to be a bit painful afterwards. But it's fine, that is normal. We are expecting it to be a bit uncomfortable. And I'm not saying this to scare you if you've not had it yet, just being sensible. You just got to be pragmatic and appreciate the fact that you're having your hip replaced. It's a big surgery. It is completely normal for it to be a bit sore afterwards. Now, that soreness will vary. Like I said, the context of different people, the way people respond to pain and deal with pain is different. That will vary. It's impossible to say it'll be the same for everybody. But the general rule of thumb is that, yeah, it's going to be a bit uncomfortable, especially in the early stages. And you will think, especially when you're in hospital, when the physio is saying, get up out of bed, start walking, your brain will be telling you, don't do it. Your brain will be making you think like, is this safe? Should I be doing this? But look, trust us. We're telling you this because we know what's best. We're telling you because we know actually the quicker you're up, the quicker you're moving, the more confident you are on it, well, actually, the healthier it is for the joint. And actually, for your cardiovascular system, it's much, much better to be up and about and moving rather than just laying dormant on your back, where actually it probably feels like that's exactly what you want to do. And the healthier it is for the joint, the healthier it also is for your cardiovascular system, because it is so much better to get up and about and moving. it gets all your blood circulating better, it's much safer, but also it gets you confident to use it. And that is key. Now, look, the more that you do, sometimes it hurts more. But that's why pain relief is there. And over the days afterwards, you will gradually see an improvement. Your pain levels will start to get less. And actually what happens is the more that you do, the better you adapt, the better your pain resolves. And then as you start to do more, sometimes your pain will get a bit more. It is completely normal. It is safe. But you have to consider the fact that just because your pain before was because of an arthritic bone on bone, whatever it level of severity was, from an arthritic hip, just because that's replaced, your pain doesn't immediately go. You're starting to deal with all the after effects of what that surgical procedure is. And you have to remember that it takes a little bit of time. So pain can sometimes be a hindrance to progression, but you just need to consider and understand, well, if this is my situation, how do I manage it? How do I make sure that I can keep it under control? And also, don't be scared to ask for support. But we're going to go through some important points for the last three, which really are going to probably set the tone for this. One of and this is point 3 now. This is probably one of the ones I'm most passionate about. But patients in some situations are given what are called hip precautions. Now, hip precautions are given historically to minimize the risk of the hip dislocating. What we know now from research is actually the level of dislocation risk is minimal. And it doesn't actually minimize the risk that much. We're talking less than 2%, less than 1% in some cases of that hip dislocation rate being mitigated versus people who don't do hip precautions. Now consider this, right? What I don't want you to do is come out of surgery, your surgeon's told you to do hip precautions, and then you turn around and say to him, yes, but doctor, I've just watched some random bald bloke on YouTube who's a hip specialist physio and has told me that I don't need to do hip precautions. If you're a physio listening to this, my advice is the same. You don't be unprofessional, don't go against what your guidance is, but ask for insight into when to stop. So if you have been given precautions, when do I stop? How do I stop? What is that threshold for me to progress? Because otherwise, I've had so many scenarios where patients are just doing hip precautions for months and months and months. And guess what? After that point, your hip stiffens up, your hip feels worse, your confidence is diminished. And actually what the research does show is that hip precautions increase the risk of fear avoidant behavior, increase the risk of kinesiophobia, so kind of like, anxiety to move or load it in certain ways. And that's not ideal because you're having this hip replaced to improve your quality of life and allow you to thrive and do the things that you want to do. So if you have been given hip precautions, fine. Make sure you know when you're stopping. And equally, many surgical surgeons nowadays may well not even give you any hip precautions and just say, look, use your common sense. There are certain things that you're not going to be able to do anyway. Just follow that rule of thumb. Now, it brings me on to my fourth point. All of this stuff segues, right? What are you going to find that is absolutely the most beneficial for you to allow you to understand your pain better, to allow you to recover quicker, to allow you to understand what the do's and don'ts are post-operatively? Physios, rehab. That is essentially what is going to allow you to recover, because this is such a challenging thing to manage on your own. And there are a multitude of locations around the world where people have surgery for this and don't have the rehab afterwards. Rehab isn't just about exercises. Rehab is also us educating you, reassuring you, giving you guidance, telling you what's normal and what's not normal. And that's really important. We're dealing with people. We're not dealing with just the hip. That hip is, funnily enough, attached to a human body and an individual. And you've got to deal with people in that way as well. So rehab for me is about building two things: physical tolerance and resilience through exercises. So getting the hip moving, range of movement, strength, capacity and functional tolerance, walking, stairs, etc. And I'm actually going to start posting some videos in regards to specific phased post-op rehab exercises. So if you haven't got any guidance and you want to follow that, definitely subscribe, and then you'll be able to kind of keep track of those. But rehab also is about building psychological resilience through the exercises that you do. So you're doing exercises to be more mobile and stronger, but then actually those exercises are making you more confident to move. And those two things are what really makes you get the best outcome. And that's so so often overlooked. If you are having surgery, make sure you optimize your outcomes by ensuring that you've got your rehab prepared and you know who is going to do it, how you're going to do it, and what to expect from that. And as a result of that, your outcomes will definitely be optimized. And I cannot say enough that you definitely need to have that input afterwards, irrespective of your age and activity level. But it brings us on to point number 5. And this point is the most commonly overlooked thing that I would say it comes when it comes down to people who have had a hip replacement. And it is so simple, right? Because like the point I said to you about the pain, the hip is being replaced, you think the pain would go immediately and it doesn't. That's the same thought process for people's walking and gait. Because if you've had hip arthritis for that long, your gait and your walking ability would have changed, the way that you move would have changed. And guys, guess what? It doesn't immediately come back and improve just because you've had the surgery. It takes time. What doesn't measure your level of improvement is how quickly you come off sticks, how quickly you come off crutches, because one, the hip is going to be weak, it's going to be deconditioned, it needs to be physically able to walk better. 2, if you've had hip arthritis for that long that you're going to have a hip replacement, well, guess what? Your hip hasn't moved in certain positions for so long that actually those muscles that work in those positions have probably weakened, have probably got deconditioned, and also need to get stronger and also need to build up their tolerance. So over that period of time of you living with an arthritic hip, where we're just having to afterwards build those things back up, and they're going to help you walk better. So don't immediately think, oh, my pain's a bit less, I'll just come off the crutches, because if your walking tolerance is diminished, or the quality of how you move isn't where you want it to be or where it should be because you've rushed off the sticks, well, that can sometimes cause other things to probably get a bit irritable, whether it's your back, whether it's your knee. And you need to make sure the quality is right, because although the hip has changed, this hasn't. And this is the thing that is telling you how to move. This is your brain is governing all these movement decisions. And it needs to get used to the fact that maybe your pain isn't there anymore, but the behavior of how you move and how you walk has been ingrained for months and months and months and years, maybe prior to you having the surgery. So don't rush off the sticks. And look, if you're following these 5 key things here and you're thinking, actually, all of this resonates with me. 1, I want 2 things from you, actually. I want 1, you to tell me and say, look, actually, and comment below here and say, look, I didn't have any rehab. Or maybe I did rush off the sticks too much. Or actually my pain was a bit more by this stage. And is that normal? And I want to see what the current trend is from people watching this. But equally, if you aren't sure with what to do, if you're struggling with rehab, the guidance and the approach, well, this is what this channel is for. And I'm going to be posting videos in regards to rehab guidance. It does not take out the fact that you need someone face-to-face if possible, or online to give you that support, but hopefully it can be giving you a little bit of guidance to support you along that way.